So Impassion-131 is the second metastatic trial that looked at atezolizumab in combination with chemotherapy. And it looked specifically for patients with metastatic or unresectable locally advanced triple-negative breast cancer, so the same population as 130. But instead of using nab-paclitaxel, it was now looking at combining atezolizumab with paclitaxel. And there's a number of reasons for that. And probably the most important is that if we think globally, not everybody has access to nab-paclitaxel. So if the trial would demonstrate that the benefit is seen with paclitaxel as well as nab-paclitaxel, that would be very informative for clinicians across the globe treating metastatic triple-negative breast cancer. Now, this study randomized patients 2-to-1. So for the 2, it was atezolizumab plus paclitaxel, and the 1 was placebo plus paclitaxel. And what was reported out at ESMO this year were the first results of this study. And we looked at progression-free survival, objective response rate, and then there was some initial overall survival data. And they presented it in 2 ways, much like they had with the 130, in the intention to treat population, which means all comers regardless of PD-L1 status, and then in the PD-L1 positive population. Now, one thing I would note, and we didn't really speak about it with 130, but for the 131 trial, 45% of the patients were PD-L1 positive using the Roche Genentech definition of PD-L1 positive, which is an IC score of 1% or greater, meaning that there is 1% of immune cells in that tumor microenvironment that stain positive for PD-L1. For 130, it was about 41%, so not that different. And what we learned at ESMO from the 131 trial was that, in fact, whereas 130 was a positive study leading to an FDA approval, 131 was a negative study. And so what was the data? So with respect to progression-free survival, and the intention to treat population, the difference was 0.1 months. So 5.6 for placebo, 5.7 for atezolizumab. We think that these patients need to express PD-L1 in order to benefit. The progression-free survival analysis in that population, 5.7 months for placebo, 6 months for atezolizumab. And this was a difference that was not statistically significant. I think of more interest, maybe even use the word concern, was their initial report of their overall survival data. And I will note that we are not far enough along in this trial with respect to follow-up of the patients that the overall survival data is mature or robust. But in fact, what we saw was kind of the reverse of what we'd want. And what I mean by that is the patients receiving atezolizumab actually did worse. And so for the intention to treat population, the median overall survival for patients receiving atezolizumab was 19.2 months, whereas it was 22.8 months for those receiving the placebo. And if we look at the PD-L1 positive population, we again see that the patients who received placebo did a bit better than those who received atezolizumab, so about 28 months versus 22 months. And again, I caution us to recognize that we need the data to mature more, but you can see why this would cause some question in the community about, kind of what's going on here. Why was one trial positive, one trial negative? And I think the take-home message is that if we are going to be using atezolizumab in our first-line metastatic breast cancer patients, and I think we should do so in combination with nab-paclitaxel. The data from 131 where we use paclitaxel does not support its use. And I think it's important for our breast community to give a lot of thought as to why that might be. There's, of course, the initial thought that it might be due to concomitant use of steroids, but we don't have enough data yet to know whether or not that's the case. And I think a lot of breast investigators will point to the fact that we have data from the Keynote 355 trial, which is the somewhat similar trial but looking at pembrolizumab, where you could use other chemotherapy agents, including Taxol, and that read out as a positive study. So I think as a community, we have a lot still to learn. But my take-home message from ESMO is that if you're going to be using atezolizumab, combine it with nab-paclitaxel.